Hello, my name is Mike Wammes, and I'm the research coordinator at the First Episode Mood and Anxiety Program, or FEMAP. Today I'm going to share some results from our qualitative work during the early stages of the COVID-19 pandemic. For those of you not aware, FEMAP is an early intervention program for emerging adults that is youth-friendly, patient-focused, and a clinically driven treatment model. We know from existing research that the current cohort of emerging adults have more mental health issues than previous cohorts. COVID closed many essential physical and mental health services early on, which has been shown to lead to worsening mental health symptoms, substance use, and even suicide. Additionally, stressors like boredom, frustration, and financial concerns also increased, and we just kind of wanted to understand the experience of the pandemic better from our patients' perspective. So we invited 325 of our patients to participate in a larger study monitoring symptoms, functioning, and feelings about the pandemic. We presented this actually during this meeting last year. But of those 325, 111 people also responded to open-ended questions that we created as part of our pandemic response questionnaire. The pandemic response questionnaire was mostly multiple choice or Likert type items, but 10 of the questions were open-ended and provided a text box for participants to enter whatever they wanted or nothing at all. This analysis focuses on two of those questions. The first one being, list the three most positive outcomes that you think might come of this pandemic situation. And on the other hand, the second question asked, list the three most negative outcomes that you are afraid might come of this pandemic situation. We took an inductive approach to a descriptive thematic analysis using in vivo to help with that. All three of the coders involved first read all of the data, became familiar with it, and then each coder reviewed the same random 20% of the data to develop a preliminary list of codes. Consensus was reached on that list of codes through many long conversations, and the entire data set was then coded again with that list and with new codes added where necessary and consensus reached again. It became clear that while we were asking people for positive and negative outcome predictions, what we actually obtained from people were their hopes and fears. On the fears side of things, people indicated that they were worried about death, prolonged impact of the pandemic, fears related to employment, related to their mental health worsening, education-related fears, the loss of contact with family or loved ones, the impacts on the economy, and then personal financial hardship as well. On the hope side, participants thought they might come out of the pandemic with a better perspective on what's important, with improved relationships, personal growth of some kind. Improvement of our natural environment was also a big one. Social changes in society for the better, more time to do the things they wanted to do, better sanitation and public health overall, and some sort of improvement in their own personal health and fitness. Here are some noteworthy quotes from the fears section. In the interest of time, I won't read any of these, but I encourage you to pause the video and read some of the compelling excerpts here from our participants if you're interested. And the same goes for this slide. Here are some responses related to our participants' hopes during the early phases of the pandemic. Again, pause and have a look if you wish. So overall, we found some interesting overarching themes and relationships that came out of these responses. We found that people were more concerned about the death of someone else than their own death. We found that these emerging adults were incredibly worried about isolation and separation from friends and family. And we actually theorized that this might be a potential driver of young people defying the provincial guidelines during mandatory closures. We also found that both fears and hopes were consistent with popular media stories at the time. For example, not being able to visit loved ones in the hospital or in long-term care homes, and also the ubiquitous imagery at the time of an improved environment without as much human activity and pollution. We found that participants were hopeful about all of the things they'd be able to get done in this extra time they had. And most interestingly, I think, we found that the removal of social pressures of school and work and even hanging out with friends and stuff were reported as positive by some people. This may be related to improvements in social anxiety symptoms and may have actually been mistaken for improvement in the condition itself by some of our participants. Overall, these results may not represent and probably do not represent the broader emerging adult population, but we found an interesting and complex relationship between hopes and fears in these FEMAT patients during the early stages of the pandemic. And lastly, here are some references and acknowledgements, and we thank you for your time.